Here's something that might completely change how you think about breast cancer. Most people believe it always starts with finding a lump, but that's actually not true. In fact, some of the most dangerous types of breast cancer don't form lumps at all. And by the time many symptoms show up, the cancer might have already been growing for months or even years. So if you've been doing those monthly self-exams looking only for lumps, or if you think breast cancer only affects older women, you're going to want to stick around because today we're diving deep into everything you need to know about breast cancer. We're talking about what it really is, the warning signs that most people miss, who's actually at risk, and most importantly, what you can do about it. And I promise by the end of this video, you'll have knowledge that could literally save your life or the life of someone you love. Now, before we jump into the symptoms, let me explain what breast cancer actually is because understanding this will help everything else make sense. So, put simply, breast cancer happens when the cells in your breast start growing uncontrollably. Now, normally our cells are pretty well behaved, right? They grow, they divide to replace old cells, and then they die when they're supposed to. It's like having a perfectly organized system where everyone knows their job and follows the rules. But in breast cancer, something goes wrong with that control system. Think of it like this. Imagine you have a factory where workers are supposed to make exactly 100 products per day. But suddenly, the control system breaks down, and instead of stopping at 100, the workers just keep making more and more products without any stop signal. That's essentially what happens with cancer cells. They keep dividing even when they shouldn't, and they don't die when they're supposed to. These abnormal cells can form a mass, which we call a tumor. Now, here's something important to understand. Not all tumors are cancerous. Some tumors are what we call benign, meaning they're like that annoying neighbor who's loud but harmless. They might grow, but they stay put and don't invade other areas. But in breast cancer, we're dealing with malignant tumors, and these are more like invasive weeds that not only grow where they are, but can also spread their roots into nearby tissue and even travel to other parts of your body. Now, most breast cancers, about 80% of them, start in the ducts. These are the tiny tubes that carry milk from the milk-producing areas to your nipple. We call this ductal carcinoma. Think of these ducts like the plumbing system in your house. They're the pathways that transport what needs to be transported. When cancer starts here, it's called ductal carcinoma. The other main type starts in the lobules, which are the actual glands that produce milk. This is called lobular carcinoma, and it makes up about 10 to 15% of breast cancers. If we're sticking with the house analogy, the lobules would be like the water heater, the place where the actual production happens. There are other less common types too, but these two, ductal and lobular, make up the vast majority of cases. And here's something interesting. The type of breast cancer you have can affect what symptoms you experience and how the cancer behaves. All right, now let's talk about risk factors, and this is where things get really important because understanding your risk can help you know how vigilant you need to be. The single biggest risk factor is being female. Now, men can get breast cancer too, but it's much less common because women have much more breast tissue and higher lifetime exposure to hormones like estrogen and progesterone. Age is another major factor. Most breast cancers happen after age 50, and your risk continues to increase as you get older. In fact, about 2/3 of invasive breast cancers are found in women 55 and older. But, and this is important, breast cancer can and does happen in younger women too. I've seen cases in women in their 20s and 30s, so age alone shouldn't make you ignore symptoms. Family history is a big one that many people know about. If your mother, sister, or daughter had breast cancer, your risk is higher, especially if they were diagnosed before menopause. But here's what many people don't realize. Family history on your father's side counts too. If your father's mother or sister had breast cancer, that also increases your risk. Now let's talk about genetic mutations, particularly BRCA1 and BRCA2. These are genes that normally help prevent cancer by repairing damaged DNA. But when these genes have mutations, they can't do their job properly. Women with BRCA1 mutations have up to a 72% chance of developing breast cancer by age 80. And those with BRCA2 mutations have about a 69% chance. That's compared to about a 12% lifetime risk for the average woman. But here's something that might surprise you. Only about 5 to 10% of breast cancers are caused by inherited genetic mutations. The majority of cases happen in women with no family history at all. Hormonal exposure also plays a significant role. Starting your periods early before age 12 or having a late menopause after age 55 increases your risk because it means more lifetime exposure to estrogen. Using hormone replacement therapy, especially the combined estrogen and progesterone type, also increases risk. And here's something many women don't know. Taking birth control pills slightly increases breast cancer risk, but this risk goes back to normal within about 10 years of stopping the pills. Lifestyle factors are hugely important, and the good news is these are things you can actually control. Being overweight or obese, especially after menopause, increases risk because fat tissue produces estrogen. Drinking alcohol regularly increases risk. Even just one drink a day can slightly increase your chances. Lack of physical activity is another factor. And diets high in processed foods and low in fruits and vegetables may also contribute to higher risk. Previous radiation exposure to the chest area is another risk factor that people often don't think about. This could be from radiation therapy for another cancer, like lymphoma, especially if it was done during childhood or adolescence when breast tissue was still developing. Now, let's move into the signs and symptoms, and this is where I want you to pay really close attention because some of these might surprise you. The most common symptom that everyone thinks about is a lump in the breast. But here's the thing. Not all lumps are the same, and not all breast cancers even form lumps that you can feel. When there is a lump, it's usually hard, painless, and has irregular edges, almost like a marble or stone. But honestly, and this is really important, cancerous lumps can also feel soft, tender, or even painful. So don't assume a lump is harmless just because it doesn't fit the textbook description. Any new lump or thickening in your breast or armpit area needs to be checked out. But here's what many people don't know. There are other changes that can be just as important as finding a lump. Changes in the size or shape of your breast, for example. Maybe one breast suddenly looks bigger than the other, or the shape seems different than it used to be. This could be a sign that something's going on inside that's causing the breast to change shape. Let's talk about skin changes because these can be really telling. Sometimes the skin over the breast might start to look dimpled or puckered, almost like the skin of an orange. We call this peau d'orange, which is French for orange peel. This happens when cancer blocks the lymphatic drainage in the breast, causing fluid to build up and the skin to develop that characteristic dimpled appearance. The skin might also become red, warm, or thickened. This could suggest a particularly aggressive type called inflammatory breast cancer, which often doesn't form a distinct lump, but instead causes the whole breast to become inflamed. This type is less common but more aggressive, and it can be mistaken for a simple infection at first. Now let's talk about nipple changes. And there are several different ways your nipple might change if you have breast cancer. The nipple might become inverted, meaning it turns inward when it used to point outward. Or there might be discharge from the nipple, and this could be clear, bloody, or any other color. Any nipple discharge that happens when you're not breastfeeding should be evaluated by a doctor. The area around the nipple, called the areola, might also change. It could become scaly, red, or irritated. Sometimes people think this is just dry skin or eczema. But if it doesn't respond to normal skin treatments, it could be a sign of a type of breast cancer called Paget's disease. Swelling in the armpit is another important sign. This happens when breast cancer spreads to the lymph nodes under your arm. These lymph nodes are like filtering stations for your immune system, and they're often the first place breast cancer cells travel when they start to spread. You might feel this as a lump or swelling under your arm, or sometimes in the area around your collarbone. Now, let's talk about pain because this is where there's a lot of confusion. Many people think breast cancer is always painless, but that's not necessarily true. While it's true that early breast cancer is often painless, some women do experience pain or discomfort. This might be a dull ache, a sharp pain, or a feeling of fullness in the breast. However, and this is important, breast pain is much more commonly caused by hormonal changes, cysts, or other non-cancerous conditions. So having breast pain doesn't mean you have cancer, but it also doesn't mean you should ignore other symptoms if they're present. So why do these symptoms happen? Understanding this can help you remember what to look for. The lump is simply the tumor mass itself, cancer cells that have multiplied and formed a growth that you can feel. The skin dimpling occurs because cancer can infiltrate the ligaments that help maintain the breast structure, pulling the skin inward like tiny ropes being tightened. Nipple discharge happens when the tumor involves the ducts that normally carry milk to the nipple. Even when you're not breastfeeding, these ducts can be affected by cancer, causing abnormal discharge. Swelling under the arm occurs when cancer cells travel through the lymphatic system and get stuck in the lymph nodes, causing them to swell as your immune system tries to fight off the abnormal cells. And if you're finding this information helpful so far, I'd really appreciate it if you could hit that like button and subscribe to the channel. It helps me reach more people with important health information like this, and honestly, this is the kind of stuff everyone should know about. Your support really makes a difference in helping me create more content like this. Now let's talk about diagnosis because understanding how breast cancer is diagnosed can help you know what to expect if you ever need to go through this process. Usually, the whole diagnostic process begins when someone, either you or your doctor during an exam, notices a lump or change in the breast. The standard first test is usually a mammogram, which is basically a specialized X-ray of the breast. The breast is compressed between two plates to spread out the tissue so abnormalities can be seen more clearly. I know it's not comfortable, but it's over quickly and it can detect cancers that are too small to feel. For younger women, especially those under 40, mammograms might not be as effective because younger women tend to have denser breast tissue, which can make it harder to see abnormalities on a mammogram. In these cases, or sometimes in addition to mammography, ultrasound is often used. Ultrasound uses sound waves to create pictures of the inside of the breast, and it can give a clearer picture in dense breast tissue. If something suspicious is seen on imaging, the next step is almost always a biopsy. This means taking a small sample of the suspicious tissue to look at under a microscope. And here's something really important. You cannot diagnose breast cancer without a biopsy. Imaging can show something that looks suspicious, but only a biopsy can definitively tell whether it's cancer or not. There are different types of biopsies. The most common is a core needle biopsy, where a hollow needle is used to remove small cylinders of tissue. This is usually done with local anesthesia, so you're awake but the area is numbed. Sometimes, if the area can't be felt but can be seen on imaging, the biopsy is done with guidance from a mammography or ultrasound. MRI or magnetic resonance imaging might be used in certain situations like in high-risk patients or to check the extent of disease. MRI uses magnetic fields and radio waves to create detailed pictures of the breast tissue. Once cancer is diagnosed, doctors look at specific characteristics of the tumor tissue. They check for hormone receptors, specifically estrogen receptor and progesterone receptor. About 70% of breast cancers are hormone receptor positive, which means they grow in response to hormones. This is actually good news because these cancers often respond well to hormone-blocking treatments. They also check for something called HER2 status. HER2 is a protein that can make cancer grow more aggressively, but there are targeted treatments specifically for HER2-positive cancers. About 20% of breast cancers are HER2 positive. For staging, which means figuring out how far the cancer has spread, additional tests might be done. These could include CT scans of the chest, abdomen, and pelvis, PET scans, which can detect cancer cells throughout the body, or bone scans if there's suspicion that the cancer might have spread to the bones. Now let's move into treatment and management, and this is where things get complex. But I'll break it down in a way that makes sense. The main treatment options are surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. The specific combination depends on the type and stage of cancer, as well as your overall health and personal preferences. Let's start with surgery. There are two main surgical approaches for breast cancer. The first is called a lumpectomy, or breast-conserving surgery. This involves removing only the tumor and a small margin of healthy tissue around it. The goal is to remove all the cancer while preserving as much of the breast as possible. This is often an option when the tumor is relatively small and located in a position where it can be removed without significantly changing the appearance of the breast. The other main option is mastectomy, where the entire breast is removed. This might be recommended if the tumor is large relative to the breast size, if there are multiple tumors in different areas of the breast, or if someone has a very high risk of developing cancer in that breast again. During surgery, doctors also usually check the lymph nodes under the arm to see if cancer has spread there. This might involve removing just a few lymph nodes, called a sentinel lymph node biopsy, or sometimes more extensive lymph node removal. Radiation therapy is usually given after lumpectomy and sometimes after mastectomy. Radiation uses high-energy beams to kill any remaining microscopic cancer cells that might be left behind after surgery. It's typically given 5 days a week for several weeks. The treatments themselves are painless and only take a few minutes, though you might experience some skin irritation, kind of like a sunburn. Chemotherapy can be given at different times in the treatment process. Sometimes it's given before surgery, which we call neoadjuvant therapy, to shrink the tumor and make surgery easier or more effective. Other times it's given after surgery, called adjuvant therapy, to lower the risk of the cancer coming back. Chemotherapy works by targeting rapidly dividing cells, which includes cancer cells, but unfortunately also includes some normal cells like hair cells, and cells lining the digestive tract. That's why chemotherapy can cause side effects like hair loss, nausea, and fatigue. Hormone therapy is used when the cancer is estrogen or progesterone receptor positive. Medications like tamoxifen work by blocking estrogen from binding to cancer cells, essentially starving hormone-sensitive cancers. Aromatase inhibitors work by blocking the production of estrogen in the body. These treatments are usually taken as daily pills for 5 to 10 years. Targeted therapy is used when specific characteristics of the cancer make it vulnerable to particular treatments. The most common example is trastuzumab, brand name Herceptin, which is used for HER2-positive cancers. This medication specifically targets the HER2 protein, making it very effective against cancers that overexpress this protein. In recent years, immunotherapy has also become an option for some types of breast cancer. Immunotherapy works by helping your own immune system recognize and attack cancer cells more effectively. Treatment usually takes several months and involves a whole team of healthcare providers, including surgeons, medical oncologists, radiation oncologists, nurses, and often social workers and other support staff. Now, one really important point I want to make is that treatment isn't just about killing cancer cells. It's also about supporting you through the process and helping you maintain the best possible quality of life. Patients often need help managing side effects like fatigue, hair loss, nausea, or menopausal symptoms that can be caused by hormone therapy. Psychological support is also crucial because breast cancer isn't just a physical disease, it's an emotional one too. Many people experience anxiety, depression, or fear during and after treatment. This is completely normal, and there are resources available to help, including counselors who specialize in working with cancer patients. Survivorship care is a whole area in itself. This involves regular follow-up visits, periodic scans to check for any signs of recurrence, lifestyle modifications that can improve outcomes, and ongoing support for any long-term effects of treatment. For those of you who are students or just want to remember this information better, the key things to focus on are the major risk factors like family history, age, and lifestyle choices. For symptoms, always think about lumps or thickening, unusual nipple changes, skin changes like dimpling, and any pain or swelling in the armpit area. And when it comes to treatment, remember that there are 5 main approaches: surgery, radiation, chemotherapy, hormonal therapy, and targeted therapy, and the specific combination depends on each individual case. Now, let's talk about some final thoughts and key takeaways. Breast cancer is one of the most common cancers worldwide, affecting about 1 in 8 women during their lifetime. But here's the good news. Survival rates have improved dramatically over the past few decades, thanks to earlier detection, better screening methods, and more effective treatments. The 5-year survival rate for breast cancer that's caught early, before it spreads beyond the breast, is about 99%. Even when it has spread to nearby lymph nodes, the 5-year survival rate is still about 86%. These statistics show just how important early detection really is. That's why regular screening is so crucial. For most women, this means annual mammograms starting at age 50, though some organizations recommend starting at 40. Women with higher risk factors might need to start screening earlier or use additional screening methods like MRI. But screening isn't just about mammograms. Being aware of how your breasts normally look and feel is equally important. This doesn't mean you need to do formal self-exams on a schedule, but it does mean paying attention to any changes and reporting them to your healthcare provider promptly. Remember, most breast changes are not cancer. Things like cysts, fibroadenomas, and hormonal changes can all cause lumps or other breast changes that are completely benign. But the only way to know for sure is to get any changes evaluated by a healthcare professional. If you do find yourself facing a breast cancer diagnosis, remember that you're not alone. There are excellent treatments available, and there are support systems in place to help you through every step of the journey. Don't be afraid to ask questions. Seek second opinions if you want them, and advocate for yourself throughout the process. And finally, if you have daughters, sisters, friends, or anyone in your life who could benefit from this information, please share this video with them. Breast cancer affects so many people, but knowledge really is power when it comes to early detection and treatment. The more we talk about breast cancer openly and honestly, the more we can help people recognize the signs early and get the treatment they need. Every person who learns to recognize the early signs could potentially save a life, whether it's their own or someone they love. Thanks for watching, and remember, your health is worth paying attention to. If anything we've discussed today resonates with you or raises concerns, don't hesitate to reach out to a healthcare professional. Early action could make all the difference. Take care of yourselves, and I'll see you in the next video.